Okay, welcome to video 4 of the Brainspan Quick Start series. This is Dr. Daniel Johnston. I'm going to be your host. I'm the Chief Medical Officer at Brainspan, and this video is going to be focusing on giving you a background on the overall just critical importance of this test to health and wellness, and then some concepts that'll drive the way that you talk about this to patients, and then as well as specific integration workflow into your clinic, so it just becomes part of everything you do for new patients and for patients really looking to improve their overall inflammatory status, their aging status, their disease resilience status. Any of those patients, we'll talk about that workflow as well. Okay, so, and then we'll also finish up with a little bit of a business model on the finance side. Okay, so question, why perform this test really on every patient? Well, first of all, we need to appreciate that nobody else is routinely checking the fatty acid status of patients, and that is very, very problematic because of the critical role they play. So we first want to appreciate that. First of all, most people don't know their numbers. They need to know them, and it's from young to old need to make sure that those levels are adequate for optimal health and wellness. So and then what we really just need to appreciate is that optimizing these levels is the foundation of a healthy and resilient nervous system, okay? So optimizing the levels, optimizing the cell membranes, and then we want to appreciate that these molecules, these fatty acids, they play a structural role in the cell membrane, but they also play a huge hormonal role, and all patients deserve and desire healthy hormonal balance on both sides of the inflammation cascade. And that's going to provide a very healthy and resilient nervous system, but as well as entire organ system. And what we need to appreciate is that all diseases start at the cell level, okay? Improper fatty acids levels basically disrupt the cell membrane, which disrupts everything inside the cell, as well as then throws off the hormonal balance because of the functional role. So fatty acids are foundational to cell health, and without healthy cells, we'll develop disease. This is why the test goes back to is important for every patient. All of our patients, as far as I know, have billions and billions of cells, and every person therefore needs to optimize cell health. And the other big thing is that there's an epidemic of imbalance in this country. Started back in the 50s with the way that we grew our foods, and then this is leading to just an ever-increasing prevalence of chronic disease. We're doing great at disease treatment and management, increasing longevity, but increasing numbers of people are developing chronic illness. And this is because we're just ticking time bombs of inflammatory imbalance, fatty acid imbalance. This again started back in the 50s with the way that we grow our foods. If you can appreciate this and how this is leading to epidemics of disease, then you'll be able to message that to the patients appropriately. Your patients are all walking in not knowing that the way the entire US food system is designed is to throw off this entire balance. But if you help educate them, they'll be interested in the test. Okay, now the important thing is it addresses everything from nutritional to functional, all the different clinical conditions that you're currently treating. So it's not just for those seeking to improve their health status, but it's also really seeking to address chronic conditions, most of which have inflammation and fatty imbalance driving or fanning the flames of that disease. So you need to think about disease application and those looking to just take their health to another level, manage their weight and metabolism better, prevent diabetes. It really is about patients' mindset and their clinical conditions. This is why we suggest the clinical condition form we talked about in the previous webinar. So remember, the cell's function is largely, if not primarily, dependent on the balance of the 3s and the 6s, very specific ones that we talk about in other webinars, in the cell membrane and in the cytosol of the cell, balancing the inflammation. The problem is we have a huge imbalance in society, and your patients need to know about this. You need to talk about this. And this is one of the reasons why children are having problems in schools. They're just getting fed these huge imbalances of what their cells need. And remember, the cells in the brain, the neurons, need the same, if not more, of the right omega-3s in the rest of the body. And so we're going to measure those in the patients. You're going to help the patients understand this great imbalance and be able to really do something about it with very specific science-based recommendations. And those of you that are using some of the product-specific tools that we've collaborated with some partners on, then you'll be able to have specifics on that. So it's very, very important that you appreciate the imbalance that every patient virtually has this who has not done this test. Okay, and the other important thing is make sure they know that when it comes to palmitic acid and all these fatty acids, we're measuring the cell membrane. Okay, we're not measuring plasma or serum. It doesn't matter what they had to eat last night, or did they fast, or did they not. We're looking at the cell status from the last several weeks of how they ate. And therefore, it's a nice long-term picture of their diet, and then patients need to know that. Otherwise, they think, sometimes what they did around the test time affected it. And then we're going to change the way all those cells are constructed by changing the diet day to day for the next few months. And then we're going to do the brain test, the cognitive function test, the exercise tolerance test of the brain. That's all it is. It's not diagnostic. It doesn't tell them if they have disease or not disease. It's just a standardized comparison against age and gender matched peers. How are they doing? Are they below average, above average? And and everything we measure is modifiable. You can tell them major companies of industry are using this to improve the health of their employees and productivity. And all these companies here are working with the same software platform. Be reassured, if you're a chiropractor, you're practicing treatments, you're already practicing brain health. You just need to now help address the other key ingredients that are improving the health of the nervous system and the rest of the body. So you're improving the health of the cells by decreasing people's pain, by improving function. This tool is going to just augment what you're doing on the physical side when it comes to adjustments. Remember, every person, pregnant, infant, child, adult, senior, needs to know their levels. The numbers don't lie, and most people have problems starting at a very early age because of dietary changes, and that has huge impact on the development of their brain, of the rest of their organ systems, and their risk of chronic disease. We talk about the 5 steps from check-in, your front office staff being trained, help us if you need help with that, making sure the patient's given high-quality brochures, engaging the patient while you're managing what they're there for today, and then talk about this. Because no matter what the patient's there for, improving the health of their cells will improve the dramatic health of everything. And then 3, 4, and 5, just the registration of the kit, collect the sample, do the cognitive test, and then wait for the email results. So 5 simple steps can take a matter of minutes and really provide tremendous benefit. Use the marketing materials for those different steps. I know some of our marketing materials have been updated since these slides, but again, use the posters during phase 2, use some of the materials in step 1, and then again, use the power of that web portal, your back office for Brainspan, to really help out. Get the patient to be a vehicle of getting the rest of their family engaged with the assessment, right? These assessments can be sold in family packs and taken home and then called in and registered to the right person, and it can be a source of brand new patients for you in your practice, like so many of our successful providers do. And don't forget, there's substantial revenue just doing either 5, 10, 20 assessments a month. We have on average about an 85% retest rate. If you assume only 50% of your patients retest, the numbers coming back every 90 days at 6 months and annually just grows and grows with the amount of people that you're engaging with this. But even estimating 50%, estimating the lowest retail price at $99 for the different pricing models, you can see substantial profit and substantial revenue, and this does not even include the increase in income that can come from increased compliance and initiation of new dietary supplement programs that you have in your office. Remember, every major chronic disease today in America can be traced back to improper fatty acids at some level. Granted, there's a lot of other things that contribute to it, but at the foundation, it's that cell dysfunction. Most people have problems, and the result is we've inversed those ratios. There's some language on here for vegetarians, some just ideas if you have these kinds of responses, how you can address some of the fish oil controversy and knowing fatty acids and getting the right amounts. Some other suggestions for different questions you may get. Why haven't I known about this test before? Do I think it's worth the price? Remember, this is one price that's going to affect billions of cells, trillions of cells in their brain and body when they make changes. So really convey that to them, and it's a huge return on investment. Okay, don't forget about the clinical function forms, clinical condition forms, referral forms. We talked about those before. Don't forget all the diseases that this will help improve, all the areas of general clinical concern around prevention and wellness and childhood neurodevelopment and sports performance that this assessment can benefit. And just remember, small changes over time will change the entire trajectory of your patient's lifespan and brain span, which means quality and longevity. And just be communicating that with each and every patient you see. Okay, thank you very much for watching video 4. I hope that was helpful, and we look forward to seeing you in our next webinar.